comes Melissa and Dave. We need a few more members. All our guests are here promptly. Is that Rachel and Rachel? Yeah. I thought it must be a misspelling, but you're both Rachels, huh? From the same organization. Okay.
We're both double Rachels, in fact.
Rachel R's.
Yeah.
Rachel R's. Oh, okay.
And the irony is it's both our married names. And so we both became the RRs within the last like 2 years. So.
Hi, Barbara. No, it's not Barbara, Marilyn.
I lost you. I'm coming. Oh, there we go. I'm back.
You're back. That's good.
Okay. I was trying to get a full screen.
I think we need a few more members to get quorum here. Oh, here we go.
They're coming on, just takes them a while to get going.
Good, there's Carol.
Good morning.
Morning. Do you have a lot of snow up there?
Well, we had about 6 inches. I think you guys got more in Colorado Springs, didn't you?
We got up only about 4 inches up north here, but I think
It kind of depends. Yeah, it depends on where you are. It was a little spotty or in streaks, maybe I should say.
In Kissing Camels, we have, I don't know, 8 inches at least. And it's
wow.
coming down. So yes, the
You
winter
beat us at Kissing
wonderland out
Camels.
here.
Some people are lucky. They always goes down the valley in front of us, and I get 2 or 3 inches, and they get 6.
okay.
All I know is my husband was out there with the snowblower this morning at 6 o'clock. And God bless him, the driveway is clear. It's dry.
Great. It looks like a nice wet one too, I think.
That's what he said.
Something we really need. So
That's
it could
exactly.
continue on. It's great. Nowhere to go today, so just let it snow.
Right.
Exactly.
Oh.
And that's what we both said. We're not going anywhere.
Yeah.
I got my meeting online.
I know this is the good thing about, as much as I miss being in touch with everyone, I love it like a day like today where we can just be here and casual and get stuff done.
Perfect, Marilyn. I appreciate that because that's exactly where I'm coming from.
Right.
Right. You don't have to make that long drive, Carol, right?
No, I don't mind the drive. I certainly don't mind the drive.
Mhm. Morning, Rosemary.
Good morning. How are you?
Good. Just like everybody else, I'll just stay home today.
Sounds like a great plan.
Right.
Exactly.
How are we doing on quorum here?
Mm.
5.
Well, it'll get better.
We're getting better, right?
With each minute.
Wait, we have two on the phone, don't we? So. Oh, hi, Mary.
Hi.
There's Melissa. 1, 2, 3, 4, 5, 6, 7.
We're good on a quorum, B.
We're good. Good. Yeah, I did. We've got 2 on the phone, don't we? So it helps us.
Good.
No, honey, this is all
out, Teresa, so that she can go and drink and eat guacamole. I don't know how she did.
Well, I think we're good on the quorum. So I'm going to call the meeting of the Regional Advisory Council to order. Welcome, everybody, on this snowy day. And as we were just commenting, it's sometimes having a Zoom meeting is awfully nice. On a day like today, you don't have to worry about getting out on those icy roads.
Yeah.
Okay, so our consent items. We have our agenda. Are there any changes we need to make to that? Hearing none. Our minutes. Are there any additions or corrections to our minutes from our January 28th meeting?
You know, I'm sorry, I did not receive the agenda. That could just be me, but, oh, okay, there we go.
Oh.
That's what I was wondering, if you could put that up. So thank you.
That
Right.
works, Marilyn. Thank you. At least I
Yeah.
get to see it while I'm looking.
Right, and there's always a link to the material.
I've got it on my tablet.
Oh, okay.
Yeah, when you get the notice for the meeting, if you scroll down, you'll see there's a link to meeting
Oh.
materials.
Okay,
Okay,
great.
okay, so I'll entertain a motion to approve the agenda and minutes.
I so move.
I'll second.
Thank you. That was Bill Bowles.
Right.
moved
Carol
and
Parks.
Carol Parks seconded. All in favor, say aye.
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 I
Aye.
Those opposed? Okay, the agenda and minutes are approved. We are now, we are open for public comments, but you had to submit those ahead of time. I don't see anything on the agenda. Is that correct?
Yes,
Go ahead.
Madam Chair, just in a discussion this morning, I have invited Lauren McCoy. She's with the Office of Emergency Management for the Pikes Peak region. I've asked her to come in to share with us some ongoing vaccine efforts as part of our public comments today. And I believe I did see her on.
Good morning, I am here.
Excellent.
Great, thank you. Go ahead. Go ahead, Lauren.
Well, hi, my name is Lauren, and like Jody said, I'm with the Pikes Peak Office of Emergency Management. We've been working in coordination with public health since the beginning of the COVID-19 pandemic response. Most recently, we've been asked to set up a call center as part of the effort to reach the 70+ community for vaccinations. The online signups have been an issue. Not everybody is tech friendly or even has access to it. And we have seen through the numbers that the 211 call center or direct provider phone lines just aren't working for many of our older population. So we're hoping to launch this direct calling initiative where our call center is actually reaching out directly to seniors with the phone list provided by local medical providers in partnership with public health, starting next week, Wednesday, Thursday, and Friday, and actually getting them signed up into slots to get a vaccination. So one, we'd like to make the announcement just to let everybody know that this is an initiative we're taking. We're also open to anyone who's interested in volunteering to help with the outreach. We do absolutely follow all of the protocols. We have social distancing and disinfection in place, and masks are mandatory in the call center area, or the entire building really, of course. And so if anybody's interested in assisting with reaching out to our senior populations, be happy to have any extra help. But another thing that we wanted to reach out to your group for as well is to, oh, I'm sorry.
Where is that building? Is that a long ways away from everywhere, or is it centrally located, or what?
Fairly centrally located. It's on Mark Dabbling Boulevard, which runs between Garden of the Gods and Fillmore. It is the Pikes Peak Regional Office of Emergency Management building.
Thank you.
You're welcome. So the other thing that we wanted to post to the group was if you have any ideas, better ideas, other ideas to reach out to the 70+ population, because we're seeing that only about 50% of the 70+ population has received at least one vaccine to this date. Other than that, open to questions, but that's what I had for you guys this morning. Thank you for letting me be here.
Okay, I do have another question. From that call center, are we able to call? I personally have had a really drastic reaction to the first shot. And I've been on hold several times trying to report that to somebody, but I really can't get through to anybody. I'm kind of afraid to get the second shot until I talk to someone. And I don't know how to reach someone.
With that, I would suggest calling the 211 call line. They would be able to either put you directly in touch with a provider or to whom you could report that to. They have the direct links to everybody, and all you do is dial 211 from a phone and it connects you straight to them.
Thank you.
You're welcome.
So Lauren, how do we get in touch with you for outreach if someone did want to help to volunteer? Who would we contact?
Thank you. I will, actually, it just got put in the chat.
Okay, great.
Hi, Lauren. This is Laura Cruz, the mobility coordinator for PPACG. I just wanted to make for sure, as you're standing up the call center, we actually sent out standard communication for around transportation for call centers last week. And if you don't have that, I can definitely send that to you. That way, as you're making calls to seniors, you can give them transportation options.
I believe we had that information when we were running a call center last week, but if you would share it with me, that way I can be sure that we have the most up-to-date information, I would greatly appreciate it.
Will do.
Thank you.
And Lauren, did you say that the actual call center will be live next Wednesday? When does the call center go live?
As long as we can get through the hurdles of some of the HIPAA requirements with the public, with the providers lists, we're hoping Wednesday, Thursday, and Friday of next week.
And do you have that call center number yet that you would want to share with us, or are you going to wait till it's closer to the time that it goes live?
Our goal with this is to not have anyone have to call into us, but actually for us to reach out directly to those seniors.
Ah, thank you. Okay.
Kind of a reverse call center.
Yep, exactly. Okay, super.
How do we tell you that we're going to come?
If you will, you can either call my number that's in the chat, or you can email me and I will get you set up with one of the shifts and all of the information that you would need.
Thank you.
Thank you.
Thank
Lauren,
you. Oh, go ahead.
I was just asking, are you covering just El Paso or is this also including Teller, our park?
I can't answer that for sure, but I will reach out and verify that information.
And I have another question. One of the things I'm very concerned about, and I'm in Teller County, is we have seniors that are homebound and can't get out. So I've been trying to figure out a way that they're able to get the vaccine. Do you have any information on that?
I will ask. I know that in El Paso County, we have a program that just launched yesterday for homebound individuals, but I am not for sure on what Teller County is putting in place for that. I'll ask that question to our public health partners and see if they have any information.
Okay, great.
This is Joe. I know some people who are trying to get a vaccine, but haven't been successful yet. How can they make contact with you?
If
they're waiting.
Are they on wait lists?
No.
Okay. And they're in the 70+ community?
Mm-hmm. Yeah.
Okay.
I would say, so calling 211 is a great first step for them. If they just call 211, the 211 call center people will actually, they can forward them directly to the providers' direct phone numbers.
Okay, that's good.
And then they would get in touch with a provider and get set up for an appointment, depending on who their providers are. Providers are not restricting that only their patients can get vaccines through them at this time, but for a lot of people that makes them more comfortable because they're familiar with the processes in place.
That's good. It's not by computer. And so that's part of the problem for them.
Yes.
So 211. All right, thank you.
Direct them straight to it.
Great, thank you.
Thank you.
What is any other questions for Lauren directly?
Yes.
We'll have other vaccine updates here shortly.
Lauren, what is the address of the building that you've mentioned on Mark Dabbling?
It is 3755 Mark Dabbling Boulevard.
Thank you.
Thank you. And I'll be sharing that. If anybody is interested in volunteering and contacts me, I'll make sure that we share that information with you in all of the information too. Thank you.
I might be able to help. Thank you.
And Lauren, I will share after this meeting if any other questions come up. So I do want to address, if I may, just as part of public comment, because I don't want you all to have to wait till the very end to hear my comments and updates. Thank you, Lauren, very much for being with us today.
Yes, thank you.
I do want to share a couple things that have been mentioned just in these questions. Kathy mentioned this as well as Mary has a question here around homebound. So there are a variety of efforts going on to actually reach out to known homebound seniors directly. Part of that is lists from medical offices that have been shared with a very specific directed team at El Paso County Health. So right now, what I'm about to share is specifically El Paso County Health. Kathy, after this, I will share some contact information. It might be good for you and your team there to contact them to see how they're doing it operationally. And so I'm happy to share that here by email with you. Right now, like I mentioned, there is a very specific team at El Paso County Health that is reaching out to homebound seniors. Right now, they've started with lists from medical offices. Those medical offices have vetted or confirmed that homebound status. And so they're currently working on that. We have just received a list of homebound seniors, which, as you know, there may be crossover, but we're not worrying about that too much right now. We will be standing up a process where we will be calling out to the list that was provided to us from the state, which is drawn directly from the database that is used here at Area Agency on Aging. We will contact those seniors directly. We have a few questions as directed from County Health. We will then pass along those names of those interested in receiving the vaccine at home. They will receive a follow-up call from the fire department, who will be organizing those direct vaccines in the home. A lot of questions have come up around what if there's a caregiver in the home that is essentially homebound with their patient, and County Health has told us that they will be answering those and reviewing those on a case-by-case basis. So the challenges, as you might imagine, are the amount of vaccines available. Many of you have heard, I'm sure, that once you open the vial, you have, there are multiple doses in each vial, but those vials have to be consumed within a very specific time frame, or they are useless. And so there are a lot of logistics going on. Our part of that is reaching out to yet another section of our aging population to make sure that they don't get lost through the gap. So I was going to share that later, but since that was a high priority in this conversation, I thought I'd go ahead and jump in and do that now. So I'll have some more information during my report out. Thank you, Madam Chair.
Thank you. And as you said, we'll get more information a little later in the meeting. Okay, we are going to move on then to our provider presentations. Dave Summers is here to the Outreach and Development Director for Envita, and he's going to tell us about Envita's initiatives.
Thank
Go
you so
ahead,
much,
Dave.
B. Thank you, B. I think I can share my screen, can't I?
That's the
Yeah.
idea, Dave. Give it a shot.
Let me see if I can be successful here. You cannot start screen share while the other participant is sharing.
Oh, let me stop my screen share.
Okay.
Okay, try again, Dave. Sorry.
All right. I'm gonna go to Did I get it?
No.
We're just seeing a list of files.
We see your file tree, but not the document itself.
Maybe you need to double click on it.
Wow. I did on mine. It opened. It says I'm screen sharing now. I wonder if it's taking a second.
Maybe.
Dave, do you have multiple screens?
No.
Okay.
You're screen sharing the whole agenda. I mean, the whole list.
Yeah, I know. But I clicked, double clicked on it. I opened it. It's looked fine on my end and it's not on your end.
Go through and go to share. Again, it should give you options of which tab open you'd like.
Let me. Go back. Not there. Did that do it?
No.
No?
But send the file to Melissa and she can pop it
I
up.
still have my list there, don't I?
No, you're not sharing right now.
Okay. Your screen.
Dave, if you want to email me that and we'll start with.
Wait a minute. Let's try this.
Okay. This is looking good. There it is, Dave.
Okay. Okay, I'm gonna go from slideshow from beginning. We got it?
Yes.
Yay, okay. In Vita, we have been working with AAA for a number of years, and I just want to start off by saying thank you to the advisory committee and to AAA for the support they give us to work in this community. We couldn't do what we do without you. We have been around in the community for more than 50 years now. And our legacy has always been assisted transportation for residents of Colorado Springs, going above and beyond services provided by the city's paratransit system. However, today we look much different than we did back then. Our core transportation services that we get through AAA are assisted transportation here in town. We do transportation now. We took over the Mountain Community Senior Services volunteer program in Monument. We're doing a couple of public routes out into eastern El Paso County. We've expanded up into Teller. We also do in-home support services, and we're actually a part of the voucher program under AAA to provide some respite services and home health up in Park County. So we've got a lot of different things going on. The biggest change, though, that I want to make sure that everyone knows is that this past year has been revolutionary, that we have now collaborated closely with Silver Key and Fountain Valley. We have merged our databases. which means that all three organizations are able to serve older adults in this community to make sure that nobody falls through the cracks. And we are collaborating on scheduling and managing rides throughout this community. I just want to thank Silver Key and Fountain Valley, who are such strong partners. And for that relationship, it has been critical to our success this year. We recently launched a new phone system, and that phone system is also among all three partners. And it is enabling us, we have taken over the one ride number from the city, as a lot of what the city has done has now rolled over to PPACG to manage. And so it's been a major shift for all three of our organizations. And I think it is just nothing but beneficial to the community. And I wanted to make sure that I shared that as we got started. But Envita does serve a number of counties. When you look at this very first slide, we are in El Paso, Park, Teller, Fremont, Crowley. We are licensed for Crowley and Otero for home care. So we're in a 7-county area right now. And our mission is and has been to promote access and support independent living with dignity. Our goals, particularly more recently, has been truly around the areas of healthcare access and equity. We really want to make sure that the community finds the most affordable, efficient way to get to where they need to go. And so that means reducing the emergency transport costs so that our partners in the community, like even the Colorado Springs Fire Department, if they answer a call and they can refer something to us and we can help make that ride happen. It saves taxpayer dollars if we can do something that is more affordable. We've also implemented on-demand technology. What does that mean? Well, historically in the area of specialized transportation, you often have to schedule a ride a week, 2 weeks, even 3 weeks out in order to find availability for a ride. With our new on-demand technology, we are now providing nearly 40% of our rides are requested and fulfilled in less than 48 hours notice. That's a phenomenal response.
Really good.
And it's been particularly critical this past year under COVID, when we have had increases in mental health issues in this community, substance use disorders, and COVID rides. And these are also, this would include hospital discharges. The hospitals have been full and they need to get people in and out of there, and finding a transit provider who is willing to take a patient who has been compromised by COVID has been tough. But Envita has been there to help the community do that. And we've been responding to the hospitals within hours. So that's been a huge change. But let's talk about what COVID did to us this year. COVID truly delayed a lot of full-scale implementation of some new plans. We were working hard, for example, to partner and come alongside people like agencies like Teller Senior Coalition and Cripple Creek Transit. And we were trying to fill some gaps up in Teller County to help people get down the hill to care. And with what was happening with COVID and a lot of stuff going on, moving to telehealth, a lot of the medical providers moved to telehealth, and that was mandatory. So it delayed some of our full implementation of plans. We went back to really revisit partnerships and build new scenarios on what the needs were in the community and how we could fill those needs. I wanted to show this chart because it really tells a story of what happened when COVID hit. You can see in January into February, our rides went way up. And we were on track. We had built new relationships, particularly in the area of behavioral health. And we were working with Aspen Point, Peak View Behavioral Health, and others to make sure people were meeting appointments. Then COVID hit and we took a nosedive. and it came way down, and it took the rest of the year to bring things back. We did finish the year at 87% of normal, which we think is phenomenal when you think about what happened with MMT and the number of people that stopped taking city transit. Other transit providers, your Lyfts, your Ubers, a lot of folks in the community were having trouble because who wanted to get onto public transit? It was a scary thing to do. So how did we make it happen that we finished at 87% of normal? Well, we did expand our geographic reach to include Teller and Park counties. We did expand our service parameters to include behavioral health rides, including substance use disorders. We expanded our service hours. We found out this past year that to really be responsive to the community, we needed to open and be ready to start delivering rides at 5 a.m. Yes. And then we were also, whoops, trying to see, I've blocked my own view here. One second. The last thing there was, oh, and the on-demand rides that I was talking about earlier that we've been able to do. We also implemented Safe to Ride. And this was, we just overnight, we started doing social distancing on our buses. Most of our riders were the only rider on the bus, unless we could make sure they were at least about 8 to 10 feet apart. We added antimicrobial film to the surfaces on all of our vehicles. And that was through a grant from AAA that we were able to do that. We adapted our operations, expanding the service hours in the area. The other thing we did that I don't know that folks are aware of is that the city stood up a homeless isolation shelter. The fear was that people who were homeless and tended to congregate for meals, tended to congregate for other reasons, would be super spreaders of COVID. And so the city set up this homeless isolation shelter where anyone who was sick and homeless could get care. But how were people going to get there? And when they reached out to transit providers throughout the community, we raised our hands. Our drivers actually said this would be the right thing to do. We didn't demand that our drivers do this. We asked them if they were willing, and our drivers said yes. And so we became the transit provider for the homeless isolation shelter to get people to safety. With the behavioral health rides and the SUDS rides, as the demand grew for behavioral health, and what happened, when I say demand, a lot went to telehealth, except when people are in crisis. When people are in crisis, they still need to be seen. And the demand skyrocketed up over 40% in some cases throughout the region. And people needed to get very quickly to their appointments. And some of these came from Teller County. And they didn't necessarily go just to El Paso County because the facilities were full. So we started taking people to Bent County. We started taking people to Denver. We reached out throughout Southern Colorado and up into Denver to get people to care. And we found ways to pay for this. As a matter of fact, on some of our hospital discharges, we actually got somebody home to Del Norte. I talked a little bit about the homeless isolation shelter already. The other thing that happened this past year is that in Medicaid, they decided that they were going to do a statewide brokerage where anyone that was doing non-emergency medical rides needed to call a central number. Well, that transition didn't go as smoothly as the state thought it would. And Envita applied for and received a waiver so that low-income people who qualified for non-emergency medical could still work with us directly. And so we were able to fill a gap. And this gap really occurred primarily with folks who needed rides with less than 48 hours notice, because this brokerage could not take people who couldn't schedule a week out. Well, if you're in crisis, if you've got a medical crisis, you don't always schedule that. You don't know it's coming. And so they needed a transit provider who could respond. And so again, that's one of the reasons that our on-demand rides have really gone way up, is because we said we would help. And so our crisis intervention has been really important this past year. And again, please keep in mind that with the collaboration we're doing, when I talk about Envita now, sometimes if we can't take the ride, we reach out to our partners, Silver Key and Fountain Valley, to see if they can, because we want to make sure that people don't fall through the cracks. In our behavioral health focus, we do have a couple of key pieces of technology that we're using now. One we call a facility portal. We're setting up a lot of healthcare providers so that they can go out online and schedule rides with us directly. That has been a major shift. It helps cut down on the amount of time it takes for healthcare providers to get information to us, because our phone operators are often on the phone. The other thing that we have done is set up a smartphone app to where riders can, right on their smartphone, schedule rides. And by the end of 2020, with this technology, we already had 588 rides scheduled through that, probably in just the last 3 months of the year. And it has really taken off as we start with 2021. I don't even have that number right now, but it's really going up. It's been a great tool. What are we doing in Teller County? We continue to make sure. We finally did formally launch our service in September. We do have a vehicle up there. We do have a driver up in Teller County. We have been working directly with Aspen Point, Joint Initiatives, the schools, to make sure that when they have kids or people who are low income and they're needing to get to appointments down here that are odd hours, there might be people that can't get into within the working parameters of Teller Senior Coalition. Maybe we can help. And so we're trying to coordinate with folks up there to make sure that these service gaps are filled. So we've developed a number of new alliances with different healthcare providers in the region, UC Health, Centura. A lot of the behavioral health providers are now working with us. The hospitals and the hospital discharge, I've talked a little bit about that. The last thing I wanted to say, what is it exactly we're doing up in Park County? This is a program called Friends and Family. Under non-emergency medical, it's possible for people to find family members or even drive themselves if they need to get to an appointment. And if they qualify for Medicaid, they can get reimbursed for that ride. Once again, the brokerage has had a tough time filling that need. And so we are filling that need in Park County. And any of those folks who are finding friends or family or are driving themselves to medical appointments and they're on Medicaid, we have all the forms necessary for reimbursement on our website. We're getting folks referred to us by DHS in Park County, by Park County Rural Health. We're doing dozens of these a month now, but that is our way to help fill a gap in Park County as well. We don't have anything more going on in Park County at the moment, but at least we're able to start with this service. So again, we've got a lot going on. A lot of shifting has happened this past year to make sure that we are meeting the needs of the community. What we're trying to do is make sure that in any given day, if we get a call or a request, we can say yes, and then we figure it out. Because the point is the community, the needs have shifted, and we need to shift and respond to the needs of the community. And by working with you and AAA, You folks have been very responsive to the changes in the community and working with our new partners. I feel like this year, 2021, we are well positioned as a network of providers to meet any need that's going on in the community. So again, the partnerships are working, the collaboration is working, and I thank you again for your support, and I'm open to any questions.
Are there questions?
Bill Bowles, I just want to comment, I'm glad to see you coming into Park County. We do need to recognize that Park is basically two counties. There's the 285 corridor from about Fairplay to Denver, and then the rest of us. And
right,
there's a lot of difference.
Right. Right. And right now we are doing the friends and family reimbursement throughout all of Park County.
And once again, Dave, if someone up in Park County wants to avail themselves of your services, how do they do that?
It's all on our website, but they can also call our transit line. I don't have that right in front of me. It's the 301. I could get it for you and put it in the chat here in a couple of minutes. But
Hey, Dave,
yes,
there's a phone number on the car right there, the 719. Can they call that number?
Yes.
On the van or on the?
Yeah, that's it.
I see it there. Great.
There we go. Thank you. Thank you, Melissa.
You guys are great.
Dave, there's a couple of questions for you in the chat, if you can see that.
Oh, okay. Let me get out of this. I'll turn this off. Stop sharing. And that way I can go into the chat. Are you able to transport essential care providers with the senior rider that should have said caregivers? One of the big things we are doing right now is we are available for anyone that needs a vaccine ride. So if somebody's trying to get vaccinated, we now are working again with Silver Key and Fountain Valley to serve anyone that's trying to get vaccinated.
Can the
I think
caregiver,
that's what that question is referring to.
No,
can
it's
the
not.
caregiver ride along?
That's what I wanted to ask.
I'm sorry, I don't understand your question.
Can the caregiver ride along? So
Is our policy with somebody who qualifies for a ride to bring somebody who needs to accompany them? Yes.
good.
Thank you, B.
Are there other questions? I was going to mention this later, but I think I'll bring it in right now. I was happy to see in the Monument Tribune an article, Envita offers free service to vaccination appointments.
Yes.
So I know, just like the rest of you, there was a time when Northern El Paso County, we didn't have a lot of services. And so
Right.
it's great that
Yeah.
you're providing that.
We have gotten some media attention just in this past week about the fact that we are doing that. I would like to correct some of the media to again acknowledge our partners, because this is a combined effort. This is not all just Envita.
Mm-hmm.
And Laura Cruz has been working really hard on this too. I know that she's taken all kinds of calls from call centers throughout the community saying, help, we need transit support. And so we have all been working with Laura to make this happen.
Wonderful. I think we ought to do a map of some type showing the links between the various organizations. That would be fun
my,
to see.
we are all closely linked, and we are all trying to do the right thing.
Well, thank you so much, Dave, for bringing us up to date and for all your adaptation for the COVID's circumstances. We really
Yeah.
appreciate it.
Yeah, it's been a challenging year, but we feel like we're well positioned in 2021.
Thank you. Okay, we have Rachel and Rachel from Project Angel Heart. Rachel Rooney, our government grants manager, and Rachel Robinson, vice president of program operations. So I'm going to turn the program over to the two of you.
Awesome, thanks, Bea. I'm Rachel Robinson, VP of Program Operations, and then we have Rachel Rooney as well. So I'm going to lead the conversation today only because I have been the kind of point person for the organization with Pikes Peak ACG up until recently, but Rachel is now taking over the government grants portfolio, so she will be your main point of contact going forward. I do want to just make a small note before I jump into my presentation. Since we were talking about vaccines, in our Denver office, we are hosting vaccine pop-up clinics on Monday, and I know it's a bit of a drive from the Springs, but we are vaccinating individuals age 65 or older, and we do have availability this coming Monday. If anyone they know of that is in need of a vaccine, hasn't been able to secure an appointment right now, I just put the information in the link. People can either self-register or email that email address or call that phone number, and there's our address for our location, just in case folks are looking to get somebody in as soon as possible. So
Where do we see that?
It's in the chat. And I'll send, make sure I email that over to Melissa in case there's some follow-up notes. But we are hosting on Mondays in partnership with the Colorado Department of Public Health and Environment. Currently just in our Denver location, fingers crossed we can expand to our Colorado Springs location, but more to come. So, all right, let me pull up my presentation here. Great. Perfect. You should, are we able to see my screen?
Yes, we are.
Awesome. So thank you all. We are a new provider for PPACG. And so I really just wanted to take a kind of high level overview about what it is that we do as an organization and answer any questions that you may have. And Rachel, feel free to jump in as I miss anything. Full disclosure, I'm from the Coast, unfortunately, and I talk fast, so I will try to make sure I slow it down for everybody today. But if I'm going too fast, feel free to let me know.
And I'm also going to field questions in the chat. So if while Rachel is flying through this, you have questions, please feel free to write those in and I'll respond.
Awesome. Thanks, Rach. So Project Angel Heart is a 501c3 nonprofit that was actually started 30 years ago. We initially started in response to the HIV epidemic. Our founder had friends that were diagnosed with HIV or AIDS, and the cultural reaction kind of across the world when somebody is ill is to provide them food. And so that's really kind of how we started. We started in a church basement, even though we're non-denominational, and then we have kind of grown over the years. And so we originally started in Denver. However, we expanded to the Colorado Springs and Pikes Peak region in 2005. And our mission is really to provide medically tailored nutrition, which I will explain in a moment, to folks living with chronic and life-threatening illnesses. So essentially, we're really looking to provide nutrition that aims to adhere to whatever illnesses folks have to improve their health and well-being. So to qualify for our meal program, individuals, as I had mentioned, need to be living with a life-threatening illness. So this is something as cancer, heart failure, chronic obstructive pulmonary disease, which is lung disease, kidney failure, Alzheimer's, something in that capacity. And then they need to have difficulty shopping or cooking for their meals. But overall, our agency does not have any age, income, or residency requirements for our program. But obviously recognizing we dedicate PPACG funding specifically to individuals in the Pikes Peak region that are age 60 or older. And we really target those dollars to the priority populations identified from the Older Americans Act, which is either low-income individuals, people of color, low-income people of color, and when possible, individuals in rural communities. This is just a quick snapshot of the demographics of our client population in the Pikes Peak region that is age 60 or older. So you can see here for race and ethnicity. And then for the age breakdown, it's actually a pretty even split between the individuals age 60 to 70, 70 to 80, and 80 or older. And I wanted to give a big overview of kind of what it is that we do and what our bread and butter, pun intended, is for our agencies. So this is a quick snapshot of our meals that we provide. So we have a team of 7 professional chefs, registered dietitian, nutritionist, dietetic technician, etc., that work collaboratively together to create menus that we then tailor to meet the individual needs and diseases and side effects that our clients are living with. So this is an actual picture of one of our meals. So you can see the meals themselves come in a meal tray, almost like a TV dinner, that is either dual ovenable, so it can be put into the microwave in case it's serving as respite for an individual, or it can be placed into the oven in case folks want to feel engaged in the cooking process, recognizing how personal food is. But all of our meals are actually delivered frozen, recognizing that folks, if they're going through chemotherapy treatments or otherwise, might not necessarily have the appetite right when a meal delivery is occurring. This also then allows us to provide a bulk delivery of all meals at one time. So on the left-hand side of the tray, you can see we'll have some vegetables, which provide the appropriate vitamins, minerals, and antioxidants that power the body's cells and functions. And then on the right-hand side is where we will have kind of that entree that we're creating, which is an appropriate mix of carbohydrates, protein, and fat to provide our folks with the appropriate nutrition that they need to build muscle mass, energy, etc. So here is kind of a large overview of the meals offerings that we provide. So anyone that's applying for our meal service is put on one of these main diets. So we have a renal diet for folks with kidney failure, an allergen-friendly diet for folks that are avoiding the top 8 allergens. We have an unseasoned diet, which is going to be our meals just without any strong spices or flavors. And that is really what's reserved for folks that are going through chemotherapy or radiation treatments, recognizing there's changes in taste acuity that often happen, or if folks just don't necessarily want kind of vibrant flavors depending on where they're at. We also have a vegetarian diet and then a heart-healthy diet. Any one of these diet offerings is also diabetic friendly. So after an individual selects whatever diet that they're going to be on, across the bottom is the additional modifications we can make and accommodate for our clients' different needs. We provide a gluten-friendly diet, which means that it's avoiding the gluten, a GI for folks that are having gastrointestinal issues. We do texture modifications for folks that need things pureed or pre-cut, depending on their dexterity or dental issues. We'll also provide modifications on the protein that we provide. And then we have some additional side items we provide in a meal bag that we'll modify for folks. So essentially we create 7 entrees a week. And within each entree or each recipe, we modify that in about 18 to 20 different ways to accommodate the needs that our clients are living with. So what exactly is a medically tailored meal? So this is an example. We have a meal called tandoori chicken that's served with couscous and broccoli. And you can see here when we're making it dairy-free for our allergen diet, we don't include yogurt. For a lower potassium diet, which would be a renal, we take out tomato. For unseasoned diet, we make sure that there's no seasonings or garnish. Low sodium, no salt, etc. Get the idea. For those that are gluten-free, we sub the rice instead of couscous, etc. But this is all great, but here's a quick visual for you to understand. This is all one recipe that we are modifying in the different ways to meet the unique and individual dietary needs of our clients. I will provide a quick note. I understand the bottom photo of a pureed meal does not exactly look entirely appealing. However, a lot of our clients are on that diet, unfortunately have issues swallowing, and this enables them to still get that nutrition they need. And our chefs and dietitians do make sure that it's at least visually appealing in terms of color sometimes. So what actually comes in a meal bag? So in the Pikes Peak region, we make deliveries on Saturdays between the hours of 10 and 12 every Saturday. So we have a partnership with Care and Share Food Bank where we have all of our volunteers meet there to distribute meals out within their community. All right. In each meal bag, folks will receive a minimum of 7 entrees. And then we also provide 2 servings of fruit, a loaf of bread, 2 servings of milk, as well as a little bit of dessert. And while that is outside of the nutrition standards we're looking to meet, we also recognize the mental health impacts that a delicious chocolate chip cookie can have on a weekly basis. For folks that are struggling to maintain weight or depending on the illness that they're living with, we'll also provide 7 days worth of breakfast as well, so up to 14 meals in any given week. However, because of the contents of that bag, where we're really just looking to provide extra calories to folks, they don't meet the Older Americans Act standards in the way we would like them to, so we don't actually charge, or we don't actually attribute Pikes Peak Area Council of Government funding to those breakfast bags, just because it's more like cereal, peanut butter, things like that. In addition to providing the medically tailored nutrition, part of our standard program offering, recognizing folks are living with illness, is we provide nutrition education. So at the start of receiving meal service from us, clients will receive a nutrition guide that provides them really tangible, easy tips and tricks on how to eat for their diagnosis. And then on a monthly basis, our dietitian also provides nutrition education for folks on a variety of topics. We also provide individualized nutrition counseling completely free of charge for individuals that are interested. Recognizing our client population varies from everybody with a new diagnosis to somebody that's maybe at the end of life. We really look for direction from them on where they're at in terms of whether or not they want to engage in that nutrition counseling. Additionally, what we do would not be possible without an army of volunteers. I had to go through and find all of our COVID photos. I had some really great ones, but I wanted to make sure everybody was still making sure or wearing masks in these. So every week we have volunteers that support us, everything from the cooking of our meals, to the dish up of our meals, to the packaging of our meals, to the distribution of our meals. This is Jeff Alexander, who's one of our Colorado Springs Regional Council members, and his beautiful daughters at Karen Share Food Bank, and then to the delivery of our meals as well. And so these are folks that come every Saturday, volunteer driven, to deliver these meals out to folks within the community. Each route we provide our volunteers is about 2 hours, recognizing that the integrity of the meals stays for about 4. So we want to make sure everybody's done before something could potentially go wrong. And so we love our volunteers, and they actually make a tremendous impact. So Project Angel Heart overall has a statewide catchment area. So we are able to provide meals in a variety of ways throughout the entire state. The home delivery component that is funded by Pikes Peak is specific to Colorado Springs in this map here. However, we do also provide folks in Teller, Pueblo, etc., but they may have it so that they'll pick up meals from our office in Colorado Springs, or potentially will deliver to a family member or friend that they then subsequently get the meals from them. And then on an annual basis, our volunteers in the Colorado Springs region drive over 15,000 miles to deliver meals for our clients. And so this year alone, let me look at my notes, we're going to be delivering over 106,900 medically tailored meals to folks within the Pikes Peak region, which is a pretty impressive undertaking that is all led by our volunteers there. And then I wanted to talk about impact. Obviously, we all know how food affects us. If we're eating something, I know the Girl Scout cookies are out in full fledged right now, and I may have had a few too many Samoas last night that made me not feel great today. But we do know that when you're providing nutrition that's really designed to improve health, that it can have a great impact. And again, I talked about the scale where we're meeting folks where they are in their health journey, but 66% of our clients report that our meals specifically improve their health regimen. So whether or not they have nutrition that now allows them to tolerate their health or their medications or treatments, or otherwise, 66% say our meals help. 70% say that they're better able to afford their health care or their basic needs because our meals are provided completely free of charge to our clients. And then 64% report that they're better able to remain independent at home or contribute their ability to stay at home specifically due to our meals. And 70% report that they've got improved quality of life. And I am a big nerd. And at one point of time, I decided if this is all true, there must be a way to actually quantify that in terms of dollars and cents on the impact we're making on the community. We actually completed a research study a couple of years ago that found that when people receive our meals, again, tailored for their health, that their healthcare costs go down. So we actually saw a 13% reduction in 30-day readmission. So in terms of folks going back to the hospital within a period of time when they received our meals compared to a control group. And similarly, we know that our clients actually have an average of a 24% reduction in their medical costs when they receive our meals, which is a pretty tremendous impact. I won't bore you all with the details, but we're currently involved in a randomized clinical trial with a larger insurer within the state in which we're evaluating the appropriate duration of service. But recognizing social isolation is a huge component in COVID, particularly with older adults. That's one of the key components we're looking at here is whether or not that our meal delivery service has impacts on depression, CATS, and HEDIS scores for those that are familiar with those measurements that I won't bore you with. And that does my presentation. Rach, do we have some questions in the chat I can answer?
I think I've covered the questions, but if anybody has any more, please share.
Are there other questions? And how do you connect with these seniors in particular?
Absolutely, that's a great question, B. So on our website, there is an opportunity, and there's multiple ways folks can access our program. So we have an entire client services department that does outreach to care providers throughout the state of Colorado to let them know that our meal program is available, it's free of charge, and how to refer folks. If any of you, for instance, were on the call right now and either know of somebody in need of service, we can, you're able to download an application online from our website. There's also an online application you can fill out right then and there, or you can call us in which we can fax that paperwork or email that paperwork over to somebody's care provider. So someone can say, I'm ill, I would be interested in receiving your meals. And then we just need their doctor, clinical social worker, somebody to say, yes, indeed, they are sick. And then we'll get folks set up right on meal service. And currently there is about 7 days between an individual's application and first meal delivery within the Pikes Peak region. Other questions?
Mary had a question about volunteering in the chat, but that might be nice for everyone to hear.
Great. Forgive me, I didn't see that question. If you want to read it or answer it, Rach.
Yeah, just looking, where do volunteers work? Do we have a need for volunteers? I know the answer is always yes.
There is always a need for volunteers. The location is Care and Share, so I will put that location and the specific address in the chat. For folks that are interested, I will also put the link for our website on how you can sign up to be a volunteer. And then we are looking for support on Saturday mornings. There's a shift that goes from about 8 a.m. to about 10:15 a.m. where we're actually getting the meal bags and routes kind of set up for other volunteers to come and get them to deliver. And then as I had mentioned, delivery shifts are between 10 and 12 every Saturday. We are looking for whatever commitment you all can contribute. So whether it's weekly, it's bi-weekly, it's once every 6 months, we can accommodate whatever you all have. And then we try to generally make it sure that deliveries are within an area or part of town that you all are familiar and comfortable making deliveries with. So if you lived in the north, you wouldn't be making deliveries down in southwest of the city, so to speak.
And how long do your deliveries take in terms of, I mean, can you be on these meals for months or a year? Or?
Yeah, that's a great question. And so we do require that folks kind of recertify to ensure that folks are still struggling. Understandably, most of these folks are still struggling with these illnesses, but recertify so we can collect updated demographics, income, and then understand whether or not any modifications of the diets need to occur. So folks are on recognizing the different diseases we serve. There are different kind of disease trajectories in terms of how long we see folks on length of service. So for instance, multiple sclerosis, we see folks are on service longer, recognizing that that illness can have symptoms very commonly, and they'll go away and then they'll come back again, so to speak. Cumulatively, the average length of service in the Pikes Peak region is about 5 months, kind of overall. Obviously, there are some folks that are on infinitely longer, some that are on for a shorter period of time, and recognizing compliance with PPACG in-home services. We do an assessment every 6 months for folks that continue on.
Great.
And
Any
there's
other
a question
questions?
if we have deliveries in the Fountain Valley, Rachel?
We do, yes. There is a handful of folks. I will send over the links so that way folks can again see the specific delivery area. And then for folks that may fall out just outside of that region as well, as I had mentioned, we can make accommodations for deliveries to doctor's offices, to friends. Folks can pick up from our office as well.
And then Wendy was looking at what are the funding sources. So of course, wonderful funding coming from PPACG, but we also lead a very robust fundraising campaign to raise funds through individual giving, as well as through corporate giving in Colorado Springs. We are currently also doing some virtual fundraising efforts that will help in Colorado Springs as well.
And then we have really great support from foundations in the Pikes Peak region too. So Myron Stratton, the Colorado Springs Health Foundation. We get a really great grant from Cowgirls and Cocktails, which is specific to individuals living with breast cancer, et cetera. Giddings Foundation. So kind of broad swath of support, but the majority of our funding, about 40% of our funding as an organization, comes from individuals.
Other questions on Teller and Park and connection to hospice?
So there is no wait list, or well, currently there's no wait list for our service, but anybody that is on hospice, we will expedite them through a wait list at any period of time as well. So we will serve any individuals living on hospice, recognizing that that's really kind of support and respite for caregivers as well as individuals at end of life. And then in terms of, was it Teller and Weld, you said?
Teller and Park.
Teller and Park County. So those fall, there's a small portion that falls within our delivery area, but in terms of home delivery. So through the philanthropically funded program, again, we can coordinate deliveries for folks within that Colorado Springs region. We also have a handful of partnerships with the Medicaid rate organizations down in those regions, which we will actually pack and ship meals via FedEx as well. So it depends on their care providers in those instances. But I will put all of this info in the chat box for people as soon as I'm done talking.
Great. Well, I think thank you so much, Rachel and Rachel. It's great to hear about a newer program and become more familiar with the services you provide and how to connect seniors to those services. We'll look forward to hearing more from you in the future. So thank you so much.
Thanks for your support. We're so incredibly thankful for being a new partner with you all.
Absolutely. Thank you so much.
Sure enough. Thank you. Okay, we're going to move on then to a membership. Marilyn?
Okay, hi everyone. Yes, I think what I've got to say today in regards to membership is that in looking at the roster of members, we have 14 present members on the RAC committee. We could certainly up that, to 20. We have 3 which terms will expire as of 12/31/21. So that would be Elaine, Bill, and Marilyn. So we need to get identified from them that they will, take on another term. But as always, we need to be recruiting, especially East, more rural, Falcon membership. So just asking, that that everyone on membership be looking in this regard and throw out some names or possibilities of people that we can interview and, you know, be able to get a well-rounded membership going. And I think moving forward that, you know, I want to encourage all members to be active members. Recently, I have attended the SRC meeting with Jen Nemo and the 3-year plan, 4-year plan playing in the PPAG plan. There are so many things out there that are going to come about, whether it's educational, culturally, a lot of things, health and wellness possibilities coming up for seniors in our community, and just would invite anyone to come on to that committee and just take a listen at, you know, one of these meetings to see what's going on, and know that as Jen, you know, gives us updates about the SRC, that how we as members can become involved in helping with some of these things that they're proposing. These plans are as good as the people and funding that they have. So I think it's like a big, you know, thrust of mine to really encourage members to become active, empower you to become active in things coming up. And we do have those things, you know, things that I'll talk about, like the Adopt a Senior program, whenever that becomes appropriate here in our agenda as well. So I think that's basically it. I am also seeking a co-chair. So if anyone is interested in co-chairing the membership committee with me, I would appreciate that. I think we could use a second person to fill in at a meeting or to just be available to serve on this committee. So I think that's basically what I have to say today about membership. If there's any questions.
Terrific. So we did have a member, Chris Robertson of the Independence Center, resigned. He's moving on to some other employment. So just to let everybody know about that. Okay, let's move on to the SRS committee. Jen notified us this morning that she is not able to be here today. So Melissa's going to give us an update on their wonderful meetings that they had.
And as I share about this, I'm hoping that I'm not going to go into a lot of detail because Jen really did a great job. Took a lot of notes and actually filled in the document that you see before you. And so I'm not going to go into a whole lot of detail, just want to give a few highlights. But for people who attended that meeting, I hope that you'll jump into and share a few things. I'll start by reiterating what Marilyn already said, which was talking about looking forward to 2021 with opportunities around cultural kind of engagement work, as well as health and wellness. So there were a lot of really good ideas that were shared. But what you guys see in front of you is basically kind of a document to help us as a AAA and as a RAC kind of stay on top of our 4-year plan, instead of it just being something that gets put on the shelf and we never look at it again. Also super important to keep in mind as the TRS, the Technical Review Subcommittee, begins to take in applications from providers across the region. You know, are they meeting some of these needs that have been called out in the 4-year plan? And so basically just kind of looking, you know, far over onto the left, the first column is the service delivery. So this is what, you know, the Older Americans Act calls out for specific services. They're pretty standard, you know, the transportation, information and assistance, you know, nutrition. You'll see all kinds of, you know, the very traditional services that we're used to seeing in the AAA world. And then the area of need is a little bit more broad in terms of just reminding us that, you know, for example, here it says, you know, we want to make sure that public transportation and transportation options are easy. Well, as we look at doing that, we're actually engaging all these different service areas. You know, does information and assistance answer the calls and get them to the right places? How is it coordinated? Are we doing outreach, you know, and are the vehicles on the roads getting people from point A to point B? And so again, this group had some great conversations around things that were happening with transportation. And the major highlight was, you know, reminding that we really want to be having conversations about how to support Park County. So lots of things have been accomplished in 2020 despite COVID. And then still the reality is, what can we do more for Park County? So that was one of the highlights there. And again, I'm not going to go into a ton of detail. I just wanted to kind of bring to people's awareness. So as we scroll down through here, you know, we have categories on community safety, preventative health and mental health, dealing with the financial future. This was a fun one that we talked about because one of the pieces that we put in here that we were excited to have seen happen during COVID was the fact that Silver Key launched the 5 Wishes program. And so that was, you know, a really wonderful, you know, piece to hear about from one of the partner organizations that they did that. And then of course, our Colorado Legal Services continues to do amazing good work. And so that being said, there's still, you know, some ideas about improving and doing more around legal and, you know, financial future planning. Then let's see. The advocacy and education piece. This was another one that the group had some good conversations about in terms of respect for diverse backgrounds and ages. You know, with the Older American Act, it's so important that we're reaching out to those underrepresented groups of individuals. And so really just kind of brainstorming some ideas about how to do that. And then also doing intergenerational work as well. And so I know that the staff person from the AAA, Pamela, is on the phone, on the call, or she was earlier. You know, she's a huge advocate for intergenerational conversation and trying to, you know, kind of see how to move that forward. So there were some good conversations in the group about that too. So I'm going to stop there and hopefully just plant some seeds for people who weren't at the meeting to be excited for what's to come. And then if anybody who was there wants to offer any final closing remarks as well.
Are there any other remarks from those who attended?
I did not attend, but I'm wondering if ombudsman is the last issue on this chart.
Yes, it is. Okay. So there's ombudsman. Sorry, there's a couple of things there with the ombudsman offices. Yep.
I couldn't see it.
I didn't go down far enough, huh? I stopped.
Thank you.
Yep.
Well, we're excited that this group is getting going, moving forward, having discussions, and they'll be bringing forth ideas to the REC as a whole. If you didn't attend during these last meetings and you're interested, be sure when the notice goes out that you let Jen know that you're interested and that you get a notice of the meeting. So thank you so much. We're now going to move to Jody and the director's report.
And good morning, all. Good to see you and be with you today. I'm Jody Barker, Area Agency on Aging Director. Just as a follow-up, it's not on my list, but just as a follow-up on the 4-year plan and the SRS work, just so you know, we're already starting to plan for the next 4-year plan, even though this current 4-year plan extends through 2023. It is about 1.5 years work to produce the next. And so already within our AAA network across the state, because some of it is a collaborative effort to provide funding for some of the surveys and things like that, we're already in discussion both amongst ourselves and with the State Unit on Aging. And so that is one bit of information I should let you know, that it's constant for us, not just in producing the report, but also in engaging all aspects to make sure that we are hitting the areas that we set as goals. Obviously 2020 kind of upset that cart, but we as a staff, we as a network, we as our providers, we as RAC, all of us have done just some amazing things over the last year, despite COVID. And frankly, because of COVID, it's created an opportunity for us to look at different ways of doing things with some of the flexibility that we've been provided from the state and federal legislation around the Older Americans Act. So what I wanted to touch on today is just kind of a brief overview, as I do, what we've been doing over the last month, and to give you some ideas of what's going on in the near future. I thought, since vaccines are at the top of the agenda, I'm going to go back and take, there were a couple of questions in the chat, and I thought I would just try to answer those and provide some clarification remarks. So there was a question around a statewide vetted homebound list, and I should clarify that. The software that we as AAA staff, as well as our providers, enter all of our information into is a state mandated and state managed software. With that in mind, there are a variety of reports that we can audit, that we have access to produce. The type of report, though, that was necessary to focus to a homebound type of designation was not something that was readily available to AAA offices. And so the State Unit on Aging, which is our administrator at the CDHS offices, had to produce that report on our behalf. And so that looks at a variety of things like limitations of IADLs and that kind of thing. And so that list has been provided to us in conjunction with the El Paso County Health Department. We will be making outgoing phone calls with a series of questions to help determine and further narrow that list for vaccines in the homes. A couple of the questions that were presented were also, what if someone self-identifies as homebound? The best thing for them to do, I think, Mary, you may have reached out with this question in the chat, is just have them call our main number, the 471-2096 information and assistance line. We are gathering that information from those who are not already on our list, but who may have those questions. And so we will have a series of questions that will be asked, and then it will be handed over to the health department for further clarification and also scheduling of those in-home vaccines. So I hope that provides some clarification. Yeah. So obviously our list is not a comprehensive list. It is just those who have received services from the AAA directly, or AAA providers at some point. So that's what I mentioned earlier. There may be some crossover with the doctors, the medical office lists that they're working through now. But again, you'd much rather someone get 3 calls instead of no calls, right? So we're just part of that overall collaborative effort. So that actually brings us very cleanly into my list to share with you. So from the very beginning, but especially in the last couple of months, our collaboration and coordination has continued and has even spiked with service providers, transportation providers, I see Kathy here from Teller Senior Coalition, folks from Silver Key, and of course, Invita we heard from today. And Laura Cruz, our mobility manager, has led a lot of those discussions. Melissa Martz, our special projects administrator, she has been in calls with health department and others around vaccine efforts. In fact, she and other staff volunteered at the large vaccine site down in Fountain this past weekend. And so whether we're invited or not, we're making sure that we are known in the community and making sure that where we can make those connections, we continue to be the voice of the seniors in our region. So we've also been collaborating, as I mentioned before, with El Paso County Health Department, 211 in all areas around vaccines, transportation, the homebound project, that kind of thing. So we've been a part of a variety of meetings. In fact, one that is on a weekly basis with 211 and a variety of service providers that's specifically addressing concerns around the senior vaccine project. So that planning continues. We're nowhere near, just like you heard this morning, we're nowhere near the end of the project. It's going to be ongoing for quite some time to make sure that we bring the vaccine to as many as possible. So that will just continue. Through our AAA resources and the State Union on Aging networked, we received a shipment of face masks. They come in a 5-pack. And so if any of you know folks who could use face masks who don't have access to those, please just reach out to us. We will be happy to meet up with you at the office or bring them to an organization. There are 100 5-packs in a case. I would be happy to get those out to you. For those of you who are here representing Park and Teller County, it is my intention to actually load up my truck and bring some directly to you. So please, if you're here, reach out to me and let me know how many you might be able to use. We ask that you do not open those 5-packs, that an individual receives that sealed 5-pack. There are plenty to go around. So they are washable, they are cotton, and reusable. So if you need some face masks, let me know. For those of you who are providers, and this includes Park and Teller County, you will be receiving probably today an email inviting you to order some directly at no cost to your organization. So be watching for that email. It's actually an invitation from Percy Devine, who's one of the assistant secretaries at the Administration on Community Living. They have ordered thousands upon thousands and are making those available to our AAA networks. And so be watching for that email. There'll be a form there that you can make a direct order and have it drop ship directly to you so that you can add those to any of your client packages or outreach packages, and you're welcome to use those as you need to. So I have exciting news to share. There was a statewide report put together by our AAA network that shows the network response across the state from AAAs during the time of COVID. I will be sharing that out it'll probably come from either Melissa or Jessica so that you will get that directly. It's an online report. I'm very pleased to say that the Pikes Peak Area Agency on Aging is referenced several times, along with quotes that I know came from some of our providers as well as myself. And so very pleased to see that. So we will make sure that copy gets out to you by email. It was very well done, but it gives a great overview of efforts around the state to respond to COVID during 2020. Collaborative efforts continue around the emergency funding that we received as you know, known as the CARES Act. It's important to distinguish. There's CARES Act across the United States. Ours is specifically from the Administration on Community Living, which means that it does get directed through the AAA offices. It is separate from city, county, and state CARES Act funding. And so I just like to throw that out there so that you know that it is specifically for use for serving our 60+ population. We still have some CARES Act funding we're working through right now, but I will tell you that there are at least 2 funding packages related to the COVID environment that we expect to receive. We've received some very general numbers, but I'm not going to share that until I have a contract in hand. But just know that they are substantial and a great opportunity for continuing to serve our community. So we'll share more as we hear more, but I've been told there's a package related to the congressional funding that was signed before the end of the year. And there's also a request from the Administration on Community Living, who, as you may know, is the federal level oversight for the Older Americans Act and the appropriate funding as it works its way down to the individual regions across the United States. They have put in their request for the portion of the 1.9 trillion that's in discussion right now on Capitol Hill. So more to come on that. Aside from that, so that's emergency funding. We are still waiting for our options letter for new state fiscal year 21-22. But we are beginning the RFP process to work with current and potential future providers for the next state fiscal year. And so if you have served on the TRS in the past, I want to remind you that you'll be getting an invitation soon to set aside a couple of days as we get closer to that process where we can review requests and go through recommendations and such. So I will, you'll be hearing more from us on that, especially if you've been a past TRS member. If you have not and you're interested in that, since Chris is not here, Chris Larson is the chair of the TRS. TRS stands for Technical Review Subcommittee. They review, they work with the staff to review requests, funding requests from providers and future providers related to funding for the next fiscal year. So if you're interested in sitting in on that committee, please let Melissa know, and she will begin or help organizing that process. Another piece of exciting information, I think we might have touched on it at the last meeting, but I just want to bring it up again because it's very exciting. As you know, our office, Pamela Hogard and Roma Costanza and Gretchen and Karen and Barbara, all from our case management team, as well as several other members, including Jessica McMullen, our communications director. They have produced what's called the INT retirement series over the last 6 years with INT Credit Union. This year, INT Credit Union asked if we could expand that statewide. And so we have, I say we, it's they have, I've played a part, but it's really proud to say they have just jumped in on that with both feet. They've been working with INT and other providers, and that retirement series will essentially double. There will be 10 presentations across the entire year related to that retirement series. So at least 2 of each topic across the course of the year. And like I said, it will be offered statewide this year. We've been working also, my portion has been working with my fellow AAA directors to generate some resources. And so it's really exciting to see that kind of program, not just recognized, but asked to and collaboratively expand. So I'm very excited about that. That's what I have right now. If you have any questions, please share now, and I'll take a peek at the chat as well. Bill, I see your email or your text. I will be happy to give you a call here in a bit. All right, Madam Chair, I guess that's it. I will hand it over to you.
Okay. Thank you so much for the update. Just a little note on that End Retirement series. When Pamela and I started that 6 years ago, no one knew whether or not it would work. You know, we were going to have a session every week for 4 or 5 weeks, and would the seniors show up? And we had snowstorms that sometimes interfered with presentations, etc. But we kept at it year after year, and through the collaboration with, obviously, with the staff at AAA, and then reaching out to the Center on Aging at UCCS and legal professionals, etc. We were able to initiate that series, and I'm so happy to hear that it's now going to take on a bigger role and go statewide. So that's exciting to hear. In terms of my chair report, I just want to compliment AAA and all the providers. You know, you can tell how strong an organization is when you have a crisis, when you have a difficult time period, and whether or not that organization is strong enough to respond to changing needs and changing ways of doing things. And I think we've really seen that happen with the AAA and the providers during this past year. I've been, of course, most aware of how when the need for COVID vaccine signups came out, they started with online registration. But of course, AAA knew that we needed to have phone lines for our seniors, because we've had so much experience with seniors. We knew not everyone had access to online signing up. The community outreach that's been going on. We knew that not everybody can get to far distant vaccine appointments. They need to have those appointments in their own neighborhoods. And there we see the community outreach. Then questions came up about the homebound. And immediately, you know, I remember I got a call last week about that. And sure enough, I turned to Jody and Melissa, and they're working on it. So this is the type of organization, I think, that has just really responded. I mean, I even brought up a data question. I said, well, I had received a survey from UC Health, and it asked me if I wanted to get a shot. And I said no, but it didn't ask me why I said no. The reason I said no was because I already had a shot. Already had both of my vaccine shots. So raised that question once again with Jody, and he said, you know, we've been able to give some input on asking the right questions when the various organizations are collecting data. So like I say, I think I've been very pleased to see that our organization, AAA, has been, and the providers have been able to respond to the various needs and challenges, and have been able to adapt and come up with new solutions. I'm going to move on then to a new idea that we floated last month, and that's the Adopt a Senior program. And Elaine McKenzie and Marilyn Bradish Can you tell us more about where you are in planning for that? Do I have Elaine or Marilyn?
Oh, sorry, I had to unmute.
Oh, sure, sure.
Yes, it's Marilyn. Yes, Elaine McKenzie and I have decided to co-partner in this endeavor to find a needy senior that just needs some basic things. A food gift card, a food basket, some warm clothes. And it was based on Christmas time when Melissa identified or was told about a person that had these needs. And we were able to reach out to the membership. We were able to get these things done quickly, and Melissa delivered them. And we thought, wouldn't this be a great thing that we could pursue in the future? So we just needed somebody to say that we, would spearhead this and do it. So Elaine and I have talked, and we want to move forward with this. Basically today to present that indeed we want to do it, but we need the membership to help with this. And this would I'd be identifying a needy senior or maybe two in our community or park or teller that just has some very basic needs to be met. So we thought that we would do this probably on a quarterly basis so that we would have time to identify that person and then have an interview with that person and identify the needs, and then bring it back to membership to see if there would be someone that would be willing to fulfill these needs. We want to start there. We realize that maybe it's not always membership that is going to be able to, say, oh yes, this time we'll do the pajamas, the gift card or donation or whatever. So based on how we do with presenting it, that, we perhaps could reach out to organizations as well, like to get gift cards, target a letterhead to people to receive some items to help toward this need. So basically in its, formation, just wanted to put it out there that Elaine and I are going to be working on this. If you have a person that you would identify as having just a basic need, please bring it forth to our next meeting next month, and we can begin working on that person, interviewing and finding out the needs and moving forward to give a little help toward this person. It I think tugs at the heartstrings of all of us to know that there's someone that just needs a few basic things that we could help fulfill. And it worked so well at Christmas. I think that's why we decided to move forward with it. So Elaine, I don't know if you're on, if you want to add something to that, but I look forward to working with you and the two of us, trying to move forward with this.
I'm here, Marilyn, and no, I don't have anything to add. What you said is perfect, and that's where we are right now.
Okay, any questions?
I did send one.
Oh, let's see, I didn't. Let's see, Mary, let's see if you know what? It went away. So,
okay. It says potentially a request for individuals to get involved, to involve community members with what we're doing.
Oh, sure. Sure. Definitely, this would be something moving forward that, potentially could grow to be, a number of people. I think everyone can contribute something, whether we start with the membership as we did at Christmas time and fulfill it that way. As we go to our local, Targets, Walmarts, King Supers to ask for their, help in this kind of thing, and definitely reach out to community members. Yeah, there would be no limit on those things for sure.
Looks like a great deal.
Yes, hopefully so. We'll move forward with it. Thank you.
And of course, with all of our providers may easily provide us with someone that we could reach out to.
For sure. I know that we'll get the input, I'm sure.
Right. Well, thanks for taking charge of that, Marilyn and Elaine. Appreciate that. And we look forward to hearing more down the road. Are there any other discussion items by members? Any other issues you want to bring to the attention of the RAC? Hearing none, and I don't see anything new in chat either. Just as then our calendar of events, our next meeting is 10 o'clock on March 25th via Zoom as well. Our executive committee meeting is always on the first Tuesday of the month at 10 a.m. via Zoom. Are there any other events coming up that you'd like to notify us about? Hearing none. Well, thank you so much to everyone for attending today. Those were really interesting presentations, and I feel like we've been brought up to date. Definitely, if you like numbers at all, consider joining our TRS committee, because we see a lot of numbers in that committee. But I think we probably have lost a couple people, so we probably could use some new members. The first time round is a little overwhelming, but you learn. And by the second time round, you'll be an expert.
B, how many members do we have right now on?
Well, that's a good
TRS?
question. Does somebody know the answer to that?
Jody?
Yeah, we lost 2 last year because of
Term limit.
folks
for
going off the
TRS.
board. So I think it's down to 3 right now. You, Carol, so B, Carol, and Chris. And so would love to have at least 2 more.
I was going to say,
and
at
then
least we need at least 5, I think.
Yeah, so at least 2 more members would be great. And there's so if I may for just a moment, B, the expectation is that you'll receive a packet of information along with some questions that you can use as you read through the information. We're changing things a little bit this year because of the Zoom environment to make it a little smoother. And so we will actually narrow it down to just 1 meeting. Now keep in mind that will likely be around 2 to 3 hours, but we are narrowing it down to 1 meeting to help smooth the process due to Zoom, but also make sure that we are able to stay on track to meet our deadlines as it relate to bringing those recommendations back to the RAC, and then ultimately to the board of the PPACG board of directors, who have to have the final sign off. So it's a tight schedule we have to keep with this because of the process. And so we of course, I, as a fairly new director, learned a few things last year in the process, and some of my staff and I have worked on making that process a little more efficient for the members, as well as for our staff and our finance staff. So about a week of review of documents, and then 1 meeting is what we ask you to join us in. So consider if you'd like to join us for that TRS committee. We sure would appreciate it.
And I think I really, through that process, I really learned about every single service that every single provider provides. So it's you'll get an in-depth knowledge of all our providers and the services they provide through serving on that committee. So, well, if that's all the business for today, thank you again for attending, and we'll see you next month.
Thank you.
Excellent. Adjourn the meeting.
Bye-bye.
Bye, everybody.
Everyone next month.